Canesten cream is a widely used antifungal medication that is primarily used to treat fungal skin infections such as athlete's foot, jock itch, and ringworm. It contains the active ingredient clotrimazole, which belongs to a class of drugs called azole antifungals. Clotrimazole works by disrupting the cell membranes of the fungi, leading to their death and the elimination of the infection. Canesten cream is typically applied directly to the affected area of the skin in a thin layer, usually 2 to 3 times daily, depending on the severity of the infection and the specific instructions provided by a healthcare professional. It is important to wash and thoroughly dry the affected area before applying the cream to ensure maximum effectiveness. Common side effects of Canesten cream may include itching, burning, irritation, or redness at the site of application. These side effects are usually mild and temporary. However, if irritation persists or worsens, it is important to discontinue use and consult with a healthcare professional. Canesten cream is available over the counter without a prescription and is suitable for adults and children over the age of 12. It should not be used on broken skin or mucous membranes, and it is important to avoid contact with the eyes and mouth. While Canesten cream is effective for treating fungal skin infections, it is important to follow the recommended treatment duration and complete the full course of treatment to ensure the infection is fully eradicated. If symptoms persist or worsen despite using Canesten cream, it is important to seek medical advice from a healthcare professional for further evaluation and management.